Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us once again. You know, last year is going to go down as one of the deadliest flu seasons in nearly 2 decades. And we're nearing the height of flu season this year, and the need for fast, accurate flu testing is even more important than ever. Now, getting a speedy diagnosis and starting treatment within about 48 hours or so of the onset of your symptoms can really help you to bounce back faster and help keep, our loved ones and our communities safe, our schools and whatnot. Here with some tips for navigating this flu season are Dr. Norman Moore, Director of Scientific Affairs for Infectious Disease at Abbott Diagnostics, and Dr. Douglas Ambler, Medical Director of Quality for Northwestern Medicine Regional Medical Group. Thank you both for joining us on the program today.
Thank you for having us.
Well, Dr. Ambler, I've, as I'm sure many of our listeners have heard of the flu and the stomach flu. What is influenza, and is it different from the stomach flu, or is it just the flu that gets into your stomach? How do they differ, and what is it all about?
Yeah, that's a great question, because that does come up oftentimes in the office this time of year, because we do see a lot of stomach flu and influenza around this time of year. But the main difference is the stomach flu is strictly just nausea, vomiting, diarrhea, whereas influenza is a respiratory virus which causes things like high fever, cough, body aches, runny nose, sore throat. And so when we talk about a flu shot is only preventing influenza respiratory flu. A flu shot does not protect against stomach flu.
Stomach flu is kind of a nickname for something other than the actual flu.
Correct.
Dr. Moore, as Dr. Ambler was talking about, people going to work and doing the things that we normally do, why are some people more susceptible to get the flu and others aren't? I hear people saying that they've never gotten a flu shot. Others get one every year and sometimes still get sick.
Well, great question again. One of the issues is there's new flu strains every single year, so we're all a little bit susceptible because we don't build full immunity. But the bigger issue is the youngest and the oldest are the most prone to having complications. So when you're under 5 and you haven't been exposed and don't have that full immunity, we worry about those kids. And then when you're older, your immune system starts to wane. So when I think of influenza and I think about vaccines, I get the vaccine partly for myself, but again, it's also to protect the kids and the parents and grandparents to make sure that I'm not giving it to them.
The flu season, we call it, but it's the get sick season. When it comes to symptoms, Dr. Moore, when is it time to actually see a doctor? I mean, maybe it's not the flu. Maybe it's a cold. Maybe it's a sinus infection. What are some of the differentiating symptoms that say, hey, it's time to see a doctor and talk about the flu?
One of the big issues is we don't know early on. Well, the symptoms can overlap, so the person's coughing. And unfortunately, a lot of people try to tough it out. So if they're toughing it out to day 4, day 5, like you mentioned at the very, very beginning, these antiviral medications, these medications for influenza are only good if given within the first 48 hours. So if you wait too long, there really aren't any medications to give. So at that point, you may be then unfortunately giving to other people. If you do get it, wait 24 hours after the fever's gone down, before you go to work, before you bring your kids back to daycare. Otherwise, again, you could be spreading it to other people.
Dr. Ambler, I mentioned the important need for fast diagnosis. Once you think that you may have the flu, what are some of the technologies that are available for that quick diagnosis?
Yeah, I probably best have Dr. Moore answer that question, since that's the technology through Abbott, so I'll have him answer that more specifically.
One of the newer technologies is a thing called ID Now, where we're actually trying to give lab-based results right at patient care, because that was one of the issues for many years is we had some tests that were not overly sensitive. If you wanted the ultra-sensitive test, it went to the laboratory, and quite often it took too long to get the results back to actually change prescribing habits. So now that we have these tests that can occur in minutes with those lab-based results, we can, again, for those patients that demand the antibiotic, show them that the antibiotic is not necessary and get them on the right medication as opposed to guessing.
What about not, prevention? Is there anything that's going to absolutely prevent us from being susceptible to the flu?
Quite often you go back to the basics. We talk about the vaccines, but a lot of that still is hand washing. Make sure that you do the very simple things. The old soap and water is still one of the most effective tools that we have out there. And I'll probably turn it over to Dr. Ambler for any more information on that.
Yeah, no, I would agree. Those definitely start with the flu shot, hand washing. If you are sick and at home, just staying away as best as possible from loved ones at home, wearing a mask if you're going to be out in a common area. Even simple things like having a humidifier at home, we know can decrease how well the virus can live and replicate within your home.
It's obviously, talking about small kids, I guess they're a little bit more susceptible. And you mentioned, Dr. Moore, I think being exposed before you're 5 or around 5 being even more problematic than in later years.
Right. When we talk about more of the complications, more of the severe deaths, it tends to be, again, under 5, over 65, and then other conditions, like chronic lung disease, congestive heart failure, immunosuppressed. All of those people are more susceptible to complications.
Where can our listeners go online and get some more information this flu season about some of the new technology available and about the flu in general?
For the best for flu is actually our own government. The www.cdc.gov really tries to update their information as much as possible, so they will tell you if flu is in your area and anything unique about what's happening with influenza this season. For more about the testing, you can go to www.abbott.com, and they will, again, have information about the right test to talk to your doctors with.
Well, thank you both, Dr. Ambler and Dr. Moore, for joining us on the program today. Lots of great information. Thanks.
Thank you.
Great. Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.